We are quickly going to see the difference between the Quervain thyroiditis and postpartum thyroiditis. Both present as an enlargement in the thyroid gland, could be the same desencadenants. Both postpartum thyroiditis is usually seen up to 1 year after the birth of the child. In histopathology, in the postpartum we will see lymphocytic infiltration with some occasional germinal centers. And in the Quervain we will see first a neutrophilic infiltration followed by macrophage infiltration, that would be the granulomas. In the presentation, this one would be non-tender, for that is also called silent thyroiditis or lymphocytic thyroiditis. And this is extremely painful, extremely tender. So it's called subacute Quervain thyroiditis or subacute granulomatous thyroiditis. This one would have increase in acute phase reactants, creatinine kinase, erythrocyte sedimentation rate, as opposed to this one. This would not have increase in erythrocyte sedimentation rate. This can present as hyperthyroidism, hypothyroidism, or hyperthyroidism followed by hypothyroidism. This presents as hyperthyroidism, but sometimes the hyperthyroidism can be followed by hypothyroidism. Here, the cause of hyperthyroidism is that infected viral cells are destroyed, and so there is release of T4 and T3. And here, the gland is leaking T4 and T3. There is no increased production. In no one, there is no increased production. This one is that the cell is releasing T4 and T3 due to destruction of the cell. And this one is just the cell is leaking T4 and T3. So, because the gland is not producing thyroid hormone, it's not producing more thyroid hormone than usual, it's just leaking it, the radioactive iodine uptake will be low. The other difference, besides the painfulness, is the erythrocyte sedimentation rate. And the treatment for each one could be propranolol to avoid the effects of thyroid hormone in the beta-adrenergic receptors. And the Quervain, because of the painfulness, we give NSAIDs like aspirin or prednisone. In the lymphocytic thyroiditis, this is an autoimmune disease, and we can see anti-thyroglobulin antibodies or anti-peroxidase antibodies. And here we would see increased thyroglobulin because these cells are being destroyed, and so they release T43 and thyroglobulin.